Hi, I am Dr. Jagdeep. I am working as a medical oncologist in CCA Amritsar. So the common side effect with the cancer treatment which we see are like loss of hair, that is alopecia, commonly seen in the cytotoxic drug therapies. So anemia, generalized fatigue, malaise, these are usually seen with the cytotoxic therapies. Again, some of the infections which can flare up because the patient is usually immunocompromised in the patient who are taking this cytotoxic therapies. Management of the side effect can be done in a different ways. Suppose a patient who is on a strong cytotoxic drugs, we can manage the opportunistic infection by giving some sort of antiviral or antifungal treatment. So other things like vomiting can be controlled with a good treatment available with us, like antiemetics. So these things can help in reducing the cancer complications. Palliative care defines around the decreasing the symptoms of the pain and other symptomatology of the patient without curing the disease. That constitutes the palliative care, in which we give a different sort of cytotoxic drugs as well as different forms of the pain management programs to reduce those symptoms.